How did cocaine change medicine? Yes, you read the thumbnail right. You will be surprised to know in earlier times cocaine was used as a local anesthetic before the more sophisticated local anesthetics such as lidocaine, tetracaine, and bupivacaine were chemically synthesized. It has an interesting history, but before we come to it, let's quickly overview how does the local anesthetic actually work. Okay, so what exactly is local anesthesia and what are local anesthetics, right? Local anesthesia is the regional loss of sensation produced by the action of certain agents upon sensory nerves. Agents producing local loss of sensation are known as local anesthetics. These LAs reversibly inhibit nerve transmission by binding voltage gated sodium channels in the nerve plasma membrane, which prevents sensory and motor impulses from passing through. In plain English, it means on application, which could be topical, infiltration, or nerve block, it will prevent sensation for a short duration on the part where applied, and thus facilitate in surgical procedures completely pain-free. So, the history goes back to 1532 when Francisco Pizarro, a Spanish conquistador who is best known for his expeditions that led to Spanish conquest of the Inca Empire, was invading Peru in 1532. He discovered that locals cultivated a plant called coca, which is Erythroxylon coca in medical terms, and they chewed the leaves to appease hunger and to overcome fatigue. He also came to recognize the harmful effects of excessive use of coca plant, so the Spanish government first banned it, but then allowed its cultivation with heavy taxes, and they made a fortune. Messengers running long distances started carrying it around the world, but it took till 1800s to reach Europe in bulk. The first to bring a larger quantity of coca leaves to Europe was an Austrian explorer, diplomat, and a natural scientist, Karl von Scherzer. A steep rise in the popularity of cocaine was seen due to different experiments with it in medicine. Instillation of cocaine solution into the eyes of animals abolished ocular reflexes. Others employed cocaine in the treatment of painful ailments of the larynx and pharynx. It was a potent drug and quite useful, but it was not universally recognized until Karl Koller in 1884 before the Ophthalmological Congress at Heidelberg demonstrated that use of a 2% solution of cocaine into the eye allowed for ophthalmological operations without pain. It was sensational. Soon, cocainization of the mucous membranes and eyes became universal. Thus, cocaine established itself in laryngology, rhinology, genitourinary practice. Soon, surgery as well as dentistry became dependent upon it. Then, slowly, it was found out if blood flow to be decreased to the part where it was to be administered as anesthetic, its effect intensifies and a low dosage could be used to prevent toxic effects. It started to be well researched and thousands of new uses were being found out. And along with it, something else was found out too. A large number of cocaine fatalities and toxicities were being reported all over the globe. The gift of science offered to humanity was a double-edged sword. Cocaine toxicity showed symptoms of seizures, paranoia, high blood pressure, racing heart, quick and deep respiration, pupil dilation, convulsions, usually of tonic-clonic type, ultimately leading to cessation of breathing. In other cases, the convulsive seizures are almost entirely absent and fainting and collapse occur almost immediately. Temperature rise often by 3 to 5 degrees Celsius was noted. Ultimately, heart beats very slowly, skin becomes cold and clammy, cyanotic, and finally death. A very interesting side story goes this way. A young lady presented at a clinic and had a tooth removed under local anesthesia. She showed symptoms of cocaine intoxication and hysteria, however, recovered very soon and returned to her home. Soon after, one of the assistants received letters from her of lustful character, though she even did not know the assistant's name. The assistant paid no attention to these notes. He was acting quite professionally, and 3 days later the young woman committed suicide. Thus, cocaine's strong effect on body as an aphrodisiac, which increased sexual desires during intoxication, were also discovered. So, it was slowly abandoned and new drugs with comparative effects to cocaine were in research. Major advancement was the production of Novocaine, which had similar effects to cocaine and could be delivered in safe amounts relative to cocaine with minimal side effects. So that's how cocaine revolutionized the field of medical and dental surgery by allowing for invention of safer drugs like lidocaine, bupivacaine, and novocaine.